Okay, let's get John Doe's medication already. So I would take this and I would just sanitize it and then I hand sanitize. So I checked with the order and it matches all of the medication on the Mars. And we took his blood pressure beforehand and it was within reason. Okay, I'm gonna start with the ondansetron, which is for nausea. So let's write patient, write med, okay, and dose, okay, 4 milligrams every 8 hours, oral disintegrating tablet. Okay, that looks good, and the right time, and right reason. Okay, so I'll just take this, just pop that in there. Grab this. Okay. Put this back in here. Actually, you can lay it right there. And carvedilol is in here also. And the expiration dates are all good on them. Okay. Doing my 7 checks. Right patient, right med, right dose, 6.25 twice daily by mouth. 1 tablet, 6.25 milligrams, and the expiration date is good. Okay. And then acetylsalic acid, and I see that he has a allergy to this, but I'm still gonna grab it anyways, just in case. Okay, it's the right dose, right patient, yes, and it's 81 milligrams by daily and by mouth. Okay, just gonna get one on here. I'm just gonna set that one aside, and the expiration date is good. Put these back down here. Okay, and then we have psyllium. Okay, my 7 R's, right patient, 1 teaspoon by mouth, twice daily. And this is for bowel health, and the carvedilol was for like a beta blocker. Okay, I'm gonna take this. I want to fill this with water. And we need 1 teaspoon, which is 5 mLs. Making sure to read it at eye level. Okay. Just gonna pour this in the water. Give it a good mix. The expiration date was good on this. And I'm gonna mix that when I'm in the room. Then we have TheraTears. One of these. I'm just making sure to check 7 R's, 4 milliliters, 1 both eyes, 2 drops, both eyes twice daily. Okay, and right patient and everything, so that looks good. And then cortisorin is 4 drops. 4 drops, left ear, twice daily, and right person. And the expiration date looks good. Okay, and then Mylanta, which is this. Just making sure to check all the 7 R's, right? Patient, med, dose, and all of that looks good, and the expiration date looks good. Okay, I'm just gonna shake this. Making sure to hold the label in my palm. Let's see. It's 15 milliliters. Making sure to read at the meniscus. Okay, that looks good. And then Ecderm patch. It's 21 milligrams. Checking my 7 R's, right patient, right med, right, and that looks good. Okay, and then petroleum jelly. Use sparingly, so just a little bit. Put it on one of these small ones here. Just a tiny bit. Just don't grab a new one. Just lay it in there. All the 7 R's were good on this. Okay, and the expiration date was good, and I'm just making sure to check all the expiration dates on all of the medication. Okay, and then I have the PRN, so the nasal spray. The doctor ordered this PRN, which is for a stuffy nose, and all of the nasal spray, 1 spray in each nostril. Okay, and all the 7 R's look good. So I'm just gonna bring this with me in the room. Okay. I'm gonna knock, knock, knock. Hi, Mr. Doe, it's Madison, the nursing student. How are you doing? Doing good? Okay, well, I'm here with all your medication. Is this a good time right now? Yes? It should only take about 5 to 10 minutes, so do you need anything before we begin? No? Okay, well, I'm gonna sanitize here. And then I'm gonna just raise him up. Just good working height. I'm gonna make you in a sitting position here. I don't want you to aspirate on anything while we do this. Okay, and I'm just gonna check your patient identifiers. What's your last name and date of birth? Looks good, it matches. Okay, I'm just put some gloves on here. I already sanitized. Okay. We're just gonna start with the Covedolol in the cilium. So the cilium is for your bowel health, and your carvedilol is a beta blocker for your heart. And we already took your blood pressure, and that was good. Okay. So I got a pill here and then this liquid here. So I'm just gonna put this in your mouth. Okay, and then just drink it down with this. Good job. Doing okay? Yes? Okay. And then I'm gonna do the Mylanta. So this is just an antacid for your stomach, and so we'll just wash it down with the psyllium again. So good. You can just wash it down with this here. Doing okay? Yeah? Okay. That's all done. And then I have your acetylsalicylic acid here, but you say that you're allergic to it. Okay, well, we'll just put this off for now and I'll check with the doctor to make sure. What are the side effects that you get with this med? Okay, I just wanted to make sure because some of the side effects aren't out. Some of the side effects that you think may be allergies, but some aren't. Okay, so we'll just wait off on that. Okay, and then I have your ondansetron. Actually, let's just finish the psyllium up first. So, just drink that up. Good job. Doing okay still? Good. And then I have your ondansetron here for your nausea. So, we're just gonna place this on your tongue, and make sure not to just swallow it. Just make sure to let it dissolve. Okay, good. Just set that on top of your tongue. Okay, and then I have your TheraTears. So this is just for moisturizing your eyes, and this is both eyes. So we'll just open that. I'm gonna grab a Kleenex here just in case. Get that off. I'm gonna just pull that eyelid down and get it nice. I'm just gonna get it in the bottom eyelid. 2 drops. Okay. Doing okay. 2 drops in both eyes. So hold that eye open and put it in the conjunctival sac. 2 drops. 1, 2. Okay. Just wipe that. Doing okay still? Yes? Okay. Just take that. And then we have your nasal spray. This is your PRN because you have a stuffy nose, correct? Yes. Just spray it beforehand. Looks good. I'm gonna help you with this also. So I'm just gonna plug this nostril here and spray. Just make sure to breathe in really nice with that one. Good job. And then the same thing on your other one. Just breathe in. Good job. And I have this Nicoderm patch here. So I believe you have one on this arm here. So I'm just gonna take that off quick. Then I would wipe it off to make sure that there's no leftover medication on that arm. And just dispose of that one. And I have this other one here, and I'm gonna initial it with the date of birth, with the date and time, and my initials. So I did that, and then this arm here on the other side, okay? And I'd wipe with an alcohol patch if it's wet or anything. I'll just do one side at a time because I don't want to touch it. On the other side. Looks good, and then that has my name, my initials, and the date and time. Okay. And then I have this petroleum jelly here, and it's just a little bit for your rash. I'm just gonna look at that rash here quick. Well, looks like it's healing up really nice, so I'm just gonna use a little bit of this, okay? So then I'm gonna put that on there, and I note and document how it looks in the chart. Okay, I'm just gonna cover that back up. Then I have your Cordyceps ear drops for your left ear. Making sure to set this down, so make sure that it doesn't, with the cap face down. Okay, I'm just gonna, it's in your left ear, so I'm gonna have you turn your head for me. Okay, then I'm gonna pull the ear up and back and just place it so it follows the ear canal. So 4 drops, 1, 2, 3, 4. How you doing? Still doing good? Okay, well, I want you to keep your head like that, just 5 to 10 minutes to make sure it really works good in there. So, all of your meds are done, so I'm just gonna lay your head back here. Still doing good and still comfortable? Yeah, okay. I'm just gonna make sure to go document this, and I'll come back in a little bit to see how you're doing. gonna put the bed down all the way. You have your call light. I'm just gonna get all this cleaned up here next to you. I'm gonna make sure to document in your chart that you didn't take that aspirin and let the doctor know. Okay. Is there anything else I can do before I leave? No? Okay, well, you have your call light. I'm gonna hand sanitize here before I leave. Okay. Don't need anything? Okay, we're good to go. I'll be back in a little bit to check on you.